This is Epic Book Recaps, a podcast that offers complimentary audio summaries of influential non-fiction books, making learning a smarter experience. Accessing the Healing Power of the Vagus Nerve by Stanley Rosenberg. The body operates through automated systems. The autonomic nervous system is vital for managing your body's involuntary processes, such as breathing, maintaining heartbeat, and controlling digestion. Inside this system lies the vagus nerve. It contributes significantly to your emotional well-being, promoting calmness and happiness, and influences how you cope with stress. When this nerve does its job well, you feel good and relaxed. But life isn't always smooth sailing, is it? You might feel stressed or down from time to time. Symptoms like trouble sleeping or feeling like your stomach is in knots can manifest when the nervous system receives conflicting signals and struggles to maintain equilibrium. Physical symptoms often indicate underlying emotional or mental needs that need attention. In this summary, you'll discover how your body works, the reasons behind its behaviors, and strategies to strengthen your nerves for enhanced tranquility and self-regulation. So let's get started and see how amazing you can feel once you know what to do. Multitasking cranial nerves. Cranial nerves connect the brainstem with different head organs and muscles, such as the nose, eyes, ears, and tongue. Some extend through tiny openings in the skull to reach areas like the throat, face, neck, thorax, and abdomen. These 12 cranial nerves facilitate communication between the brain and various body parts. Let's delve into their roles to understand our bodes better. Olfactory nerve, CNY, enables the body's sense of smell, directly connecting the brain to discern and differentiate between various odors. Optic nerve, CN2, transmits visual data from the retina to the brain, allowing for sight. Oculomotor nerve, CN3, controls most eye movements and regulates the pupil and lens to adjust focus. Trochlear nerve, CN4, assists with eye movement, particularly eyeball rotation. Trigeminal nerve, CNV, is the largest cranial nerve, managing facial sensations and motor functions such as biting and chewing. Abducens nerve, CN6, governs the lateral movement of the eye. Facial nerve, CN7, manages facial expressions, taste sensations from the front two-thirds of the tongue, and the regulation of salivary and tear glands. Vestibulocochlear nerve, CN8, facilitates hearing and balance by transmitting sound and equilibrium information from the inner ear to the brain. Glossopharyngeal nerve, CN9, regulates swallowing, salivation, and taste sensation from the back one-third of the tongue. Vagus nerve, CNX, extends beyond the head and neck to the thorax and abdomen, influencing heartbeat, digestion, and respiratory rate. Accessory nerve, CN1, controls specific muscles involved in head movement and some shoulder movements. Hypoglossal nerve, CN13, governs tongue movements crucial for speech and swallowing. Mindfulness and meditation can positively affect the autonomic nervous system, improving emotional and physical health. Cranial nerve dysfunction can significantly impact your health, leading to stress, digestive problems, or social withdrawal. So it's essential to keep an eye on these multitaskers. Did you know? While most vertebrates, animals with backbones, have 12 pairs of cranial nerves, some fish and amphibians have even more. 3-part autonomic nervous system. The nervous system is a marvel of complexity. It took years of scientific study, experimentation, and theories to grasp its functions. One such theory is the polyvagal theory, developed by American psychologist and neuroscientist Dr. Stephen Porges. This theory states that the autonomic nervous system operates through 3 primary circuits. The first circuit involves the ventral vagus complex, a crucial part of the parasympathetic nervous system that fosters a sense of calm and social engagement. When it is active, you feel relaxed and socially connected, ready to engage with the world positively. The second circuit is the sympathetic nervous system, responsible for the fight-or-flight response. To illustrate, imagine walking alone late at night when you hear footsteps rapidly closing in behind you. Instantly, your sympathetic nervous system springs into action, triggering a fight-or-flight response. Your heart rate spikes, your breathing speeds up, and your muscles tense up, preparing you to either confront the potential threat or run away from it as quickly as possible. This immediate physical reaction happens before you have time to consciously process the situation, demonstrating how the sympathetic nervous system operates automatically to protect you in potentially dangerous situations. However, minimizing exposure to such high alert scenarios is essential. Prolonged activation of the sympathetic nervous system can lead to health issues such as elevated blood pressure and digestive disorders. Your nervous system operates in various settings, adjusting between calm and alert states based on environmental cues. The third circuit involves the dorsal vagus complex, another aspect of the parasympathetic nervous system, which triggers a freeze or shutdown response. This circuit acts as a last resort when escape or confrontation isn't possible, reducing bodily functions to a minimum to conserve energy and protect you from harm. To sum up, polyvagal theory explains how brain functions contribute to health problems, suggesting that enhancing a specific nerve's function can help heal issues caused by long-term stress or nervous system imbalances. Therefore, changing our psychological state and behavior patterns, or helping others do the same, could begin with making adjustments to the autonomic nervous system. Where is the danger? Neuroception is the nervous system's automatic sense of safety or danger. However, this system doesn't always work perfectly. Sometimes it misfires, resulting in faulty neuroception. When this happens, the body reacts to a harmless situation as if it were a serious threat, causing unnecessary stress or fear. Think of faulty neuroception as a malfunctioning alarm system that blares even when everything is okay. Now, picture yourself relaxing in a peaceful garden, when suddenly your heart races and anxiety strikes. That's faulty neuroception in action. The effects can also be far-reaching, causing chronic stress that impacts your well-being and social interactions. It's like being trapped in a state of high alert, draining your energy and leaving you vulnerable to various health issues, from heart problems to anxiety disorders. Since a person's sense of safety heavily influences their ability to connect with others, a faulty neuroception can make it challenging to maintain relationships. For example, you might find yourself pulling away from social situations or reacting defensively, driven by a misguided attempt to protect yourself from perceived threats. Gain mastery over your body and emotions to smoothly navigate social interactions. Various factors can contribute to faulty neuroception, including past trauma, ongoing stress, or conditions like autism, that alter the way the body processes sensory information. These experiences can make the nervous system overly sensitive to potential threats, triggering an exaggerated autonomic response. Fortunately, recognizing that your reactions sometimes result from subconscious processes rather than conscious decisions offers a path toward addressing the issue. It opens up possibilities for cultivating self-compassion and adopting strategies to manage stress and improve social interactions. One crucial method to recalibrate misfired nervous system signals is regularly practicing mindfulness meditation. This practice allows you to process your feelings and react more effectively. Therapy is another valuable option if you believe the situation has escalated. The conscious and unconscious memory can remain in our nervous system for months, years, or even for the rest of our lives. Understanding stress through the vagus nerve. Understanding your stress levels is pivotal for anyone concerned about their long-term health. However, relying solely on fleeting and sometimes misleading feelings can be ineffective. Fortunately, this is where the vagus nerve comes to the rescue. By understanding how this nerve works in your body, you can better understand your stress levels. There are several ways to do this. A straightforward method involves observing facial expressions. While you can attempt this solo, it's more effective with a partner. It might sound surprising, but facial expressions can give away how at ease a person is, thanks to the vagus nerve. If someone's face, especially around their eyes and mouth, seems relaxed, it's a good clue that their vagus nerve is doing its job well, helping them feel calm and ready to socialize. For those seeking a more technical approach, you can look at something called heart rate variability, HRV. It is a fancy term for measuring the variation in time between each heartbeat. That's right. The human heart doesn't always beat the same way. It changes depending on whether you're relaxed or stressed. A healthy, well-functioning vagus nerve will cause the heart rate to fluctuate, which is good. It indicates your ability to manage stress effectively and avoid becoming overwhelmed. By measuring HRV, you can get a peek into how your body's stress system works without having to guess based on how you're feeling that day. Rely less on feelings and more on body language to interpret and understand stress levels. The quest to understand this started with critical experiments by researchers curious about how the body's automatic systems are controlled. People like John Cottingham, Stephen Porges, and Todd Lyon were pioneers in this research, experimenting and finding ways to measure the function of the vagus nerve. Thanks to their groundbreaking discoveries, therapists and medical professionals can better help people manage stress, anxiety, and difficulties in social interactions, leveraging the healing power. So, how do we access the healing power of the vagus nerve? The answer will depend on the specific state and condition the person is in. As in everything else, there is no one-size-fits-all solution. Rosenberg offers a variety of exercises that aim to shift individuals from chronic stress or shutdown states into social engagement, preventing autonomic nervous system issues. We have chosen the two most popular and effective examples, so that you can decide whether a similar approach is a good fit for you. When starting healing exercises, consider keeping a simple journal to note any troubling symptoms. A good start is the basic exercise. It helps improve social engagement by increasing neck and spine mobility, enhancing blood flow to the brainstem, and positively affecting the vagus nerve. This simple and quick activity takes less than 2 minutes. Try it for yourself. 1. Start by lying on your back and interlock your fingers behind your head, allowing your head's weight to rest on your hands. 2. Move your eyes to the right without turning your head, and hold this position until you experience a sign of autonomic nervous system relaxation, like a sigh or yawn. 3. Repeat the process by moving your eyes to the left. 4. After completing these steps, evaluate any changes in neck mobility, breathing, or overall sensation. The neurofascial release technique is a hands-on alternative to the basic exercise. This technique is particularly useful for individuals who may not be able to follow verbal instructions for exercises, such as babies and adults on the autism spectrum, offering a nonverbal way to induce positive changes in the nervous system. For this, you will need an assistant. Let's start. 1. Have the person lie on their stomach for better visibility. Start on one side at the back of the head. 2. Gently push at the base of the skull, feeling for the occipital bone's hardness. 3. Test skin slidability by moving it gently to the right over the bone, then back to neutral. Repeat the same to the left. 4. Slide the skin towards the side with more resistance very slowly, stopping at the first sign of discomfort. 5. Hold this position, waiting for the person to sigh or swallow, indicating skin and muscle release. 6. Test sliding again. The skin should now move easily in both directions. 7. Repeat the process on the other side of the head. Is it possible to manage autism? Autism spectrum disorders, ASDs, are a collection of conditions that affect communication, behavior, and social interactions in various ways. Each individual with autism has a distinct set of challenges and strengths, making their experience with the disorder uniquely their own. One notable development in autism treatment is the Listening Project protocol. This approach focuses on improving how individuals with autism process sound, thus enhancing their ability to communicate and interact with others. It involves listening to specially modified music that can help tune the brain, making it more receptive to social cues and better at processing speech. This technique aids the brain in interpreting sounds and supports emotional connection and comprehension. Hearing plays a more significant role in autism than many realize. People with autism often experience the world differently, as some sounds are overwhelming or distracting, which makes it hard to focus on social interactions or verbal communication. Understanding these differences can help develop treatments that genuinely address the needs of those with autism, rather than just managing symptoms. It is possible to develop a tailored treatment for autism by focusing on how individuals with autism process sound. When it comes to treating autism, there's no one-size-fits-all solution. Each person's treatment plan needs to be as unique as their experience with the disorder. Standard treatments like behavioral, speech, and occupational therapy can help since they aim to develop communication, social interaction, and daily living abilities. However, the Listening Project protocol represents a shift toward treatments that also consider the neurological basis of autism, providing for a more targeted and effective intervention. Sometimes people on the autism spectrum are trapped in states of fight or flight or shutdown, or shift between these two states. Human knowledge of autism has grown significantly, bringing better and more personalized treatment approaches. With continued research and advocacy, the future for individuals with autism looks brighter and more promising. Did you know? Autism can be reliably diagnosed around age 2. However, signs may appear even earlier, such as lack of eye contact, not responding to their name, or delays in communication. Problems in the body's nervous system can aggravate mental health issues like panic attacks, anxiety, phobias, post-traumatic stress disorder, PTSD, depression, and mood swings. Remember, you're not alone in facing these feelings or behaviors. Many people confront similar struggles, and there are ways to improve your well-being. Consider talking to a therapist or doctor, making slight changes to your daily routine, or exploring ways to unwind. Do this. Take a moment each day to practice deep breathing. Try sitting in a quiet place, focusing on your breathing, and allowing calmness to wash over you. Add gentle movement and stretching to your daily routine to improve flexibility and reduce stress.